Health Minister Dr. Joe Phaahla is expected to give an update on the COVID-19 vaccine rollout. That's expected just after 8 a.m. this morning. So make sure you do stay tuned to the South African Morning for that live health briefing. But we also know that he'll also expected to give details on booster shots. The Pfizer booster has been approved for use in the country. Children between 12 and 17 with weak immune systems can also now register. Let's discuss this with Dr. Aslam Dasoo from the Progressive Health Forum. Doc, always a pleasure talking to you. Thank you so much for making time for us this morning. Now, there was a whole conversation, and debate, I suppose even before the Pfizer booster shot has now been approved in the country. Those who had taken their 2 jabs, wondering if they would need a third and why they would need a third. But let's just get into this so we understand exactly the importance of this Pfizer booster and why it's been approved by SAHPRA in the country. What do we know so far about this booster shot?
Good morning. Thank you for inviting me. I think this was on the cards for a while. You know that internationally booster shots are being rolled out. A third shot of the Pfizer vaccine, certainly. That's the one we use here mainly. And this has now been approved. It was found that after about 6 months following the second dose, antibody immunity began to wane. And the concern was that with new variants and so on, breakthrough infection would occur, and we've seen that. And so I think the decision by SAHPRA is correct, that the third dose of Pfizer be available to South Africans who've had the first 2 doses already. There was a limited use of it in patients who are immunocompromised, but now it's being opened for everybody. In addition, children who were given 1 shot of Pfizer are now able to get the second shot. And this is important because 1 single dose is not enough, certainly, in this situation. So I think that process is also being regularized through this approach.
So if I understand correctly, Dr. Dasoo, those with general, healthy immune system can go for their third shot after 6 months from their second shot. But if you are immunocompromised, you might need to take that third Pfizer booster shot earlier than those who are taking it in 6 months' time. Am I correct?
That's correct, yes. It's logical. Because the issue really is about trying to keep the immune response at an optimal level. We have a new variant, and it's important that we protect the people accordingly. We do have sufficient doses, so that's not a problem. The J&J vaccine the second dose is being rolled out to all the health workers who received their first dose already. So, and we expect that would also open up to those who took the J&J shot earlier this year as well.
So with that being said, as we're talking about these booster shots, the second J&J and the third Pfizer booster shot, what work, even with that being said, still lies ahead to get as many people vaccinated for their first, shots and their first vaccines? Because that primary vaccine is still important, and that messaging and, the vaccination drive is still critical at this time for everyone to get at least their first 2, if we're speaking about Pfizer here. What work do you think still lies ahead for all of us, not just the government, but even different interest groups, to ensure that, as many people as possible, if not everyone, do get their primary shots at least first?
Look, we've been in this pandemic now for 2 years. We've been through several waves. We've begun to understand a pattern of infection and what measures are effective, which are not, and so on. So let me put, first of all, I think the issue around the fairly low levels of vaccination in front of us. We are way below where we should be. Certainly for those over 60 who make up the bulk of people who get severely ill and need hospitalization, the rate of vaccination is just over 60%. And it's lower in other groups. And the problem is with this is that there's a huge amount of vaccine in stock and a drop in take-up. And we've noticed this over the last month or so. And this is a serious concern. The one major area is communication. It appears that we have not been able to effectively communicate to people who may be hesitant, who may have incomplete information. And this is the bulk of people who have not been vaccinated. It's not only your anti-vaxxer conspiracy theorists, they form a minority of this. The vaccine hesitant, as they are called, are mainly people who are just unsure or who have not heard enough, to want to come and take it, and that's a key problem. So we are in a situation where we either pull out all the stops to get people in and using whatever means capable, stop the efforts that don't work, the restrictions and so on, and focus on getting people vaccinated as a priority right now, if we want to avert the worst of this fourth wave, whose numbers are just climbing rapidly, even though we have low admissions at this point. But it's still a big worry about what's going to happen in a week or two.
Well, I appreciate you speaking to us and continuing to highlight this important conversation. Dr. Aslam Dasoo from the Progressive Health Forum speaking to me just ahead of Dr. Joe Phaahla, Health Minister, expected to give that health briefing just after 8.